Today we're going to be talking about session 7. As you know, so for each of the sessions, we usually start with a quote. And today's quote comes from Beyonce Knowles. As most of you, I imagine all of you know, Beyonce is a singer, songwriter, very famous. And she said, "Be healthy and take care of yourself, to be happy with the beautiful things that make you you." So what does that mean for us? It means that, sometimes it can be hard, um, particularly when we're thinking about health, to stay motivated and energized. But we need to take the time to take care of ourselves and be happy with the beautiful person that's each one of us. Each one of us is a beautiful person, and we're worthy of really taking that time out for our health and making sure that we're taking care of our health, for who we are, and so that we can be better people for those that are around us. So today we're going to talk about session 7, and this is the session on diabetes. Just let me go back to sharing my. I just wanted to share my screen for 1 second and go to the chapter. Now, in your manuals, before you teach this session, I would ask that you go to page 7.3 in your manual, 7.3, and there is an activity that I want you to do as a demonstration for your community members. Now, for this particular demonstration, I want you to, if you can, buy sugar cubes. Now, you need sugar cubes for it. You won't be able to use regular sugar. I guess you could, but you would have to then measure it out. But sugar cubes are easier. I think with sugar cubes, 1 cube is a teaspoon. You would need to make sure that you're checking your box of sugar cubes to make sure that that's the case. But usually 1 cube is a teaspoon. And then you want to do this activity where you're helping them to understand how much sugar is in the drinks that they may often consume in a day. So if you can set this activity up before the participants come in, and it's about guessing how much sugar they are getting in certain common drinks that individuals consume. And so with our, you can see here a fruit flavored drink, powdered or reconstituted. It's gonna have, and so usually when you're thinking about that, that's like Kool-Aid, right? Kool-Aid is one of our fruit flavored drinks that are powdered and reconstituted. It's gonna have usually 6 teaspoons of sugar in it, or 24 grams of sugar. Sparkling water, of course, sparkling water is gonna have 0. But grapefruit juice, if you buy a container of grapefruit juice, that's gonna have 6 3/4 of teaspoons of sugar, 27 grams. Soda, you can buy a Coke, and I usually use like a can of Coke, and you'll see that has 9 1/4 grams of sugar in it. Lemonade, or those lemonade flavored drinks. I have some of these items here. Like here's a tea, Nantucket tea. I have other items here as well. But you want to buy these and then set this up. And if you have sugar cubes, you can put like 6 sugar cubes there to show individuals that this is how much sugar is in your drink. Now, with that being said, as I mentioned today, we're going to talk about diabetes. And unfortunately, the facts don't lie, right? Diabetes is a serious problem for African Americans. It affects men, women, and unfortunately, even our children are affected more and more by diabetes. So they're getting diabetes at younger ages because our children are not exercising and they're on diets that are high in sugar and fat. That's exposing them to getting diabetes at younger ages. But we're going to also talk about the several types of diabetes, because there is another type of diabetes that doesn't have anything to do with weight and diet. It's type 1 diabetes, and speculated that it comes from different things. But for our purposes, what we're mainly going to talk about is type 2 diabetes. And as I mentioned, unfortunately, particularly in the African American community, children are starting to get diabetes at younger ages. About 13% of African Americans have a diagnosis of diabetes. 13%. That's pretty high. Others may have it, but a healthcare provider hasn't diagnosed it yet. So one of the things as we talk about diabetes, just like when we were talking about hypertension and it's the silent killer, you can't feel that you have hypertension. If it's too high, you might have a headache, but other than that, there's nothing that you're gonna feel that's gonna indicate you have high blood pressure. In the same way, there's nothing that you're gonna feel necessarily unless your blood sugar is very, very high. You really can't feel that you have high blood sugar, right? So it's going to be something that we have to stay on top of and make sure that we're being tested. And we're going to talk about the blood test to be diagnosed with diabetes. So there's quite a bit of individuals in our community that probably have diabetes, but they haven't been diagnosed yet. They haven't checked it out with the doctor yet to get the diagnosis of diabetes. African Americans are more likely to have diabetes and more likely to die from it than white Americans. Diabetes affects almost every part of your body. So I have sickle cell disease, and sickle cell disease can affect any organ in the body. Anywhere that blood flows can be affected by sickle cell disease. The same thing is for diabetes. So anywhere that blood flows, those tissues, those organs can be affected by diabetes, because diabetes is going to have an impact on those tissues being able to get the sugar that they need. It's going to have an impact on those tissues being able to use the sugar. And so because of that, it can affect any organ. Diabetes affects almost every part of the body. It makes you more likely to get heart disease and to have a heart attack or a stroke. So having diabetes is a risk factor that's going to increase your risk of having heart disease and having a stroke. Managing your blood sugar levels can help prevent many of the health problems that are caused by diabetes. And these diagrams are also in your manual, but and so you can use your manual, and also in your picture cards, I believe it has it already. So the body is going to take in sugar or glucose. So another name for sugar is glucose. And on food labels, you may see glucose or you may see sugar, but sugar and glucose are synonymous. They're the same things. There are other types of sugar as well, such as galactose and lactose, but your body is going to break all those sugars down into glucose. And so glucose is the type of sugar that your body uses to make energy, right? But normally, you're going to consume food, and that food is going to be broken down into fat, which we discussed earlier. It's going to be broken down into other chemicals and nutrients. We talked about sodium. So that sodium in the food is going to be broken down. It's also going to be broken down into protein, and it's going to be broken down into glucose or sugar. So when we eat foods, our body is going to break down the foods, and then the sugar component is going to be called glucose, which is a type of sugar. Insulin helps our body to absorb the glucose. So once that we eat the food, it's going to be broken down into glucose. It enters into our bloodstream and it's carried around in our bloodstream as sugar, as glucose. And then when it gets to the cells where the glucose is needed, where the sugar is needed, and all of the cells in our body needs the sugar, there's going to be insulin that's going to help the sugar be transported into the cells. So the insulin is a hormone, and that insulin is going to help the sugar move from our bloodstream into the cells where it can be used. So that's the important thing to take away from these two diagrams here. We eat food. That food is broken down into different molecules: fat, protein, and glucose. Glucose is the sugar that our body's going to use. It goes from our gut into our bloodstream, and then it's going to circulate around into our bloodstream, and then insulin helps move the glucose from the bloodstream into the cells. So we need insulin in order for that reaction to occur, or in order for the glucose to get into the cells. Now, so what's diabetes? So diabetes is when the body can't make enough insulin, or if the insulin that the body makes is not, that the cells are not able to use it. So in a healthy situation, we make enough insulin, and that insulin is able to help the blood sugar move from the bloodstream into the body. As a result of that, our blood sugar stays within that normal range and we're fine. We can have a situation, so with type 1 diabetes, what has happened in type 1 diabetes is that the cells in the pancreas that make insulin have been destroyed. Something has destroyed them, and we're going to talk about that later. But in type 1 diabetes, we no longer make any of the insulin at all. And so because of that, if we don't take insulin from, from a shot or something else, then the blood sugar can't move. The sugar can't move from our bloodstream into our tissues, and then we end up in a bad situation. So individuals that have type 1 diabetes, they don't make any insulin at all in their pancreas, and so they have to take insulin from injecting it in order to get the blood glucose, the blood sugar, to move from the bloodstream into the cells where it's needed. In people that have type 2 diabetes, and that's what we're going to mainly talk about here today, their body may not be making enough of the insulin, or the cells have become kind of resistant from the insulin. So for some reason or another, either your body's not making enough of it, or the insulin that's producing is not as effective. You're ending up with a situation where the insulin is not able to help that blood sugar, to help that sugar get into the cells. And so you're ending up with the blood, with the sugar staying in the bloodstream, and you're going to have a high blood sugar as a result of that. And that's going to lead to other problems, which we're going to discuss later. But in both situations, in a situation where your pancreas doesn't make insulin or doesn't make enough of it, or if it makes insulin and that insulin is not working properly, not working effectively, then in both of those situations, the sugar is not able to move from the bloodstream into the cells where it's needed, and you end up with the sugar staying in the bloodstream. You'll take your blood sugar, and the blood sugar is very high, but then also your organs and your tissue are not able to get the sugar that they need. So both of them will cause sugar to build up in your bloodstream, and people who have a lot of sugar in their blood, that's when we say they have diabetes. Now, pre-diabetes, and we're going to talk about that in just a minute. We want to keep your blood sugar less than 100 milligrams per deciliter. If your blood sugar is 100 milligrams per deciliter to 125 milligrams per deciliter, then that's what we call pre-diabetes. So you haven't reached diabetes yet. And diabetes is if your blood sugar is 126 milligrams per deciliter or higher. Now, pre-diabetes is when your blood sugar levels are higher than normal. It's in that 100 to 125 range, but not yet high enough to be diabetes, which would be 126 and above. 1 in 3 people, 1 in 3 have pre-diabetes. So in your group today, if there are more than 3 people, well, hey, 1 in 3 has pre-diabetes. People with pre-diabetes will often advance or progress to type 2 diabetes. So we need to make sure that we're talking to our community members about the importance of being screened to see if they not only have diabetes, but also if they have pre-diabetes. And we learned earlier in one of the previous sessions that having a blood sugar greater than 100 is also a risk factor in the metabolic syndrome. Out of those 5 risk factors for metabolic syndrome, if you remember, having a high waist measurement is one, having a blood pressure greater than 130/85 is another, having a low HDL Less than 40 milligrams per deciliter is another. Now we're talking the blood sugar. If you have a blood sugar greater than 100, that's another risk factor for metabolic syndrome. And if you and so if you have 3 of the 5 risk factors for metabolic syndrome, then you have metabolic syndrome, and that can be a situation that you make sure you want to make sure you're doing everything to take care of. Taking the small steps though, such as eating healthier foods and moving more, getting more exercise to lose weight, can help improve your body's use of insulin. So we can put ourselves in a situation where we're protecting our bodies by eating healthier foods, eating smaller portions, getting more physical activity, doing those things to lose weight can help our body use insulin more effectively and can prevent us from moving to type 2 diabetes. Now, as I said, there are 3 types of diabetes, actually. We talked about 2, right? I told you with type 1 diabetes is where the cells that make insulin in the pancreas, for some reason, they are destroyed. It can be an autoimmune, it can be related to infection of some sort, but for some reason, they're destroyed. This mostly happens in younger individuals. It usually occurs in childhood or early adulthood. And then in this case, if those cells are destroyed in the pancreas, that means that individual no longer has the ability to make insulin, and they will then have to inject the insulin into their body in order to get it. That's type 1 diabetes, where the cells have been destroyed. Type 2 diabetes is where our body still makes insulin. So our pancreas still makes insulin, but either it's not making enough insulin or the insulin that it's making is not effective. For whatever reason, the insulin is not able to move the sugar from the blood stream into the cells. So in this case, you're still making insulin. This mainly happens in adult, and this is what we usually think of when we talk about, okay, individuals that are overweight or obese, they might have the type 2 diabetes. And so it mostly happens in adults. However, unfortunately, because of the lifestyles that we have, or because of other factors, we are starting to see diabetes occur more in children. And so we need to make sure that we're educating our children that they are also at risk of diabetes, ensure that they're eating a healthy diet, lower in sugar, lower in saturated fat, and that particularly our children are getting at least 1 hour of physical activity a day. Now, if you have type 2 diabetes, now you may progress to the point that you have to inject insulin. But many people with type 2 diabetes, they may not be at that point yet. And you can usually give certain medications. There are medications that you can give to individuals with type 2 diabetes that's not insulin, but that will help the body to use the insulin more effectively. It might help the liver, or I'm sorry, it might help the pancreas to create more insulin. So some individuals with type 2 diabetes, they may progress to the point that they have to take insulin, but there may be others that they're just taking a medication. It's not insulin yet. But that's the one thing to keep in mind. Now, I did talk about 3 types of diabetes. And the third type of diabetes we want to talk about is what's called gestational diabetes. Now, gestational diabetes, just as the name implies, it happens with pregnant women. So when they're pregnant with their baby, they may have an increase in their blood sugar. This may only occur during the pregnancy, and then after the baby's born, just like with preeclampsia, which we talked about with pregnant women getting high blood pressure. Remember, preeclampsia is high blood pressure during pregnancy. No, so just as with preeclampsia, once they have the baby, their blood pressure may normalize and go back to normal. Well, with gestational diabetes, after they have the baby, their blood sugar may go back to normal. However, they're still at risk of developing diabetes later in life, but they're also at risk of other things happening as well. So African-American women are more likely than white women to have gestational diabetes. Also, women with a hormonal disorder called polycystic ovary syndrome, they're also at risk of having or developing gestational diabetes. Another risk factor for a woman that has gestational diabetes, so she's going to have increased amount of blood sugar that can have an impact on the baby. So women that have gestational diabetes may have children that are heavier. They may have children that are born with higher weights when they're born. They're born weighing more than normal births. But they're also, the baby is at risk of becoming overweight and also developing diabetes themselves. So we want to make sure that we're educating our women, particularly if they're pregnant or if they're planning to become pregnant, about not only the risk factor of hypertension during pregnancy, which is preeclampsia, but also the risk factor of developing gestational diabetes. That's diabetes during pregnancy. And that's going to put them at risk of diabetes later in life, but it's also going to put their babies at risk of being overweight or getting diabetes later in life as well. So the 3 types of diabetes that I want you to remember: type 1 diabetes, that's destruction of the pancreatic cells that make the insulin. We think it's due to some autoimmune or some viral or some other type of situation going on, but that's the one that the cells are destroyed in the pancreas and they have to inject insulin. That usually happens in childhood or early adulthood. We're going to focus though on type 2 diabetes. That's where individuals are still making insulin, maybe, or but the insulin that they make is not effective and they're not making enough of it. And that's the one that we're going to discuss mainly here. But then there's also type 3 diabetes, which is gestational diabetes. And we want to make sure that we're educating our women about the risk factor of gestational diabetes. Now, type 2 diabetes. So unlike type 1 that I talked about, and we don't know where they come from, type 2 diabetes is preventable. We can take steps to help prevent progressing to type 2 diabetes. And we talked about pre-diabetes before. So pre-diabetes is 100 milligrams per deciliter to 125 milligrams per deciliter of blood sugar. Type 2 diabetes is going to be if it's your 126 or above. What can we do to help prevent diabetes? We can eat smaller portion sizes. So that's one thing we talked about, eating smaller portion sizes. In the US, we have something called portion distortion. We think that, hey, a serving size is this massive amount. Our plate sizes have gotten bigger. Unfortunately, in the United States, the saying is go big or go home. And unfortunately, we went too big. We went too big with our portion sizes, went too big with our plates. Our cups, our drinks are now much more than one serving size. In many cases, our drink sizes might be 2 or 3, maybe even 4 serving sizes. Those big gulps you'll see at 7-Eleven, those are portion sizes that are kind of distorted, and we have that portion distortion. So eating smaller portion sizes is a way to protect from type 2 diabetes. Drinking water or other unsweetened drinks. So we don't always have to have that sweetened Coca-Cola, right? We saw from one of this demonstrations that 1 can of Coke can have 9 grams of sugar in it. What can we do instead? We can choose unsweetened drinks. There is some debate or controversy about, hey, well, some of these sugar substitutes may not be good for us. That's true, but then we can look at water or looking at something else to drink instead of the sweetened drinks. Eat less high sugar foods, such as baked goods. We need to stay away from those donuts. I love Krispy Kreme, but that's something that's giving us or exposing us to the risk factors of diabetes. So we need to make sure that we're eating less of the baked goods, the rice, pastas, those other foods that are going to be high in sugar. And then we want to make sure that we're doing at least 2 hours and 30 minutes of moderate to physical activity per day. Per week, looking at 30 minutes of exercise a day. And then, of course, as I mentioned, for our children, we want to make sure that they're getting at least an hour of physical activity a day. If you have diabetes or pre-diabetes, it's very important that you follow your healthcare provider's instructions for taking your medication, monitoring your diet, and checking your sugar levels. Now, type 2 diabetes risk factors, we want to look at the risk factors that put us at risk of getting type 2 diabetes. And that includes having pre-diabetes. So if we go out and we get checked and we see that our blood sugar is between 100 to 125, well, we don't have diabetes yet because diabetes is a blood sugar greater than 126. But having pre-diabetes is going to put us at risk of developing diabetes. So we want to make sure that we're taking those steps to prevent diabetes. If we're higher in age, so above age 45, I'm 53, so I'm at risk of developing diabetes. So I need to look at how do I take those steps to prevent progressing to diabetes. If we're overweight, especially if we have more weight around our waist. So if we have a waist measurement of greater than 35 for women and greater than 40 inches for men, then that's going to put us at risk of developing diabetes. Being physically inactive, having a family history of diabetes. I have a brother that has diabetes. I also had a mother. She passed away from complications related to diabetes. So family history of diabetes could be a risk factor for developing diabetes. It doesn't mean that you are definitely going to develop diabetes, but it's a risk factor that you could develop diabetes in the future. African Americans, so unfortunately, certain racial and ethnic groups are also more likely to get diabetes, and that includes being African American, Hispanic, Latino, Alaska Native American Indian, or Native American, Asian Americans. These are all individuals that are at risk of developing diabetes. As I mentioned, if you develop gestational diabetes, so if you, when you were pregnant, if you developed diabetes during your pregnancy, that's going to put you at risk of developing diabetes later in life. But hey, maybe, you went through your pregnancy, you weren't diagnosed, but you had a baby that weighed more than normal. That might have been a sign that you did have gestational diabetes. So you may want to be checked out if you had a baby that weighed more than a normal weight. And normal can be relative, so it's important that you talk to your doctor. Of course, if you're very tall and your spouse is very tall, and you may have a baby that's going to weigh more, but that might be that hey, it's a bigger baby because of genetics. But if you're a smaller person and you had a baby that weighed more than the average baby, well, that might be a sign, or it might be, hey, I could have had gestational diabetes during it. That's why my baby weighed more. It's important that you see, hey, gestational diabetes is a risk factor, and go get tested. Having high blood pressure. And so I have here 140 over 90, but we want to go now with 130 over 80. That can be a risk factor for developing diabetes, having depression. We mentioned polycystic ovary syndrome with gestational diabetes. And then there's a condition where you can have a darkening of the skin around your neck or under your arms called acanthosis nigricans. That can be a risk factor for developing diabetes. Now, as I said before, you're not going to necessarily feel that you have diabetes. There isn't going to be something that, hey, this is happening, I think I have diabetes. But there are symptoms that could occur that if you're diligent, you can say, hey, that might be a symptom that I might be at risk of diabetes. Now, some of these symptoms, you can see them with other things as well. So if you have some of these symptoms, it's important you talk to your doctor, and then they'll do a blood test to see if you have it. But if you're peeing more frequently at night, that could be a sign that you have diabetes. If you're feeling more thirstier than normal, that could be a sign that you have have diabetes. Losing weight without trying, feeling very hungry, having blurred vision. Now, with my brother, as I told you, he has diabetes, and actually his first symptom was that he would be driving at night and it would just seem like he could not see as well at night as he had previously. And that was his very first symptom, or something that cued him to the fact that, hey, something was wrong. And then he was diagnosed with diabetes. So having blurry vision, that could be a sign that you have diabetes. Feeling numbness or tingling in your hands or feet, having dry skin, feeling very tired, all of these could be symptoms of having type 2 diabetes. Having sores that heal slowly. So my brother, one thing that he has is that he has a sore on his foot that he'll get it and it's very difficult for it to heal. That could be a sign that, hey, I have sores that are healing slowly. That could be a sign of diabetes. So these are all symptoms of diabetes. Now, keep in mind that some of these symptoms can be with other things as well, but these can be symptoms that an individual may have diabetes. And then you want to make sure that you're talking to your doctor and getting your blood sugar tested right away. So type 1 diabetes, as we mentioned earlier, that usually develops very quickly. And so that's usually, like, as I mentioned earlier, in childhood and early adults, young adults, they may develop a situation where, for reasons that we sort of understand, but not totally, their pancreas cells that make insulin have been destroyed. And that's going to lead then to type 1 diabetes. Well, if your insulin, if the insulin producing cells in your pancreas are destroyed, then immediately you go from, well, hey, the insulin was helping the blood move from my blood vessels into the cells. Well, that insulin's not there anymore. So your symptoms are going to come on very quickly. Very bam, it happened because now those insulin cells that those insulin producing cells are now not active and you're not making that insulin. And so now very quickly with type 1 diabetes, you're going to show signs and symptoms in just a few weeks or a month. Whereas with type 2 diabetes, it may be where, hey, the insulin is not as effective. And over time, the cells can continue to become desensitized to the insulin. And so the insulin is no longer effective. So it's more of a gradual process for the type 2 diabetes. And so your symptoms and your signs and everything may happen slowly over a long period of time, that over a period of time, your body has just desensitized to the insulin that's being produced, or your body is just no longer making enough of it. And so the symptoms may develop over a longer period of time with type 2 diabetes. So now, how do we test for type 2? Or how do we test for diabetes? Well, the way we test for diabetes is a blood test called a fasting plasma glucose test. Now, you will notice that I said fasting. So when you do this test, when you do a blood sugar test to test for diabetes, your doctor may often say, hey, I need you to fast first. I need you to not eat anything after midnight, and then you'll come in the morning, because we need to have it as a fasting blood glucose. And so if you do a fasting blood sugar, and that usually measures your blood sugar after you haven't eaten for about 8 hours, 6 to 8 hours, 4 to 8 hours, you haven't eaten anything. And then I take your blood sugar. Well, that's the fasting blood sugar. And then I can look at the results. And so if I do a fasting blood sugar on you, and if your fasting blood glucose is 99 milligrams per deciliter or lower, it's less than 100, then that's good. You're normal, right? Even if it's up to 98, well, hey, you're still normal. If you have a fasting blood sugar and it's less than 99. If you do a fasting blood sugar, so I haven't eaten anything for 8 hours, and my blood sugar is between 100 to 125, well, then I'm pre-diabetic. Okay, if fasting blood glucose between 100 and 125 milligrams per deciliter, that's pre-diabetes. And then if I do a fasting blood glucose and my blood sugar is is greater than 126 milligrams per deciliter on a fasting blood glucose, well, then that's diabetes. Okay, so fasting blood glucose, that means I haven't eaten anything for 8 hours. I take it and it's less than 99, then I'm good. That's good. If it's between 100 and 125, that's pre-diabetes. I'm at risk of progressing to diabetes. And then if it's greater than 126 milligrams per liter, then that's diabetes. Okay. Now, there might be situations, though, where, hey, you're out and you're not fasting. You go to a health fair. You're eating the donuts that you shouldn't be eating because we said donuts are high in trans fat, and we said that they're high in saturated fat and other problems. But hey, we're at the health fair. You know, they have the donuts. We're eating that. We're also drinking coffee or doing other things. And we have been eating in the last couple of minutes, but then you walk up to one of the station and, hey, it's a doctor there, or it's a community health worker, and they say, I want to check your blood sugar. That's going to be a random blood sugar. So you haven't been fasting. You know, it's a random blood sugar, your random blood glucose. And if you check your random blood glucose, which usually happens at health screenings, you know, normal is below 200. So that's much higher than the 126 we said earlier. But you have to take into account that you've probably been eating, you've probably been drinking, you've probably been consuming sugar, and that's going to elevate your blood sugar. So when we do a test for type 2 diabetes, we want to make sure it's a fasting blood glucose. That will give us a better indication. But we can also look at screening blood glucose, which is done at health fairs. And then we want to look at, is it less than 200 milligrams per deciliter? So if you're at that health fair and you've been eating donuts and drinking the coffee and so forth, but then they say, hey, no, your blood sugar is greater than 200 milligrams per deciliter, then you really need to see your doctor, because chances can be high that you have diabetes. Now, here I'm going to talk about the highs and lows of blood sugar, right? Individuals that have diabetes are going to be treated with medications that help insulin move the sugar from their bloodstream into the cells, right? Either they're injecting insulin, or they could be taking a medicine that causes their body to produce more insulin or use that insulin more effectively. But at any rate, you're taking a medication, or including insulin, that's moving the sugar from your blood into the cells. Now, when you're doing that, and if you're also doing physical activity, or if you're also doing other things, when you do that, you're gonna burn sugar, right? If I'm physically active, I'm gonna start burning sugar. And so we have to make sure that we're educating individuals that have diabetes that, hey, you can have blood sugars that are too high. That's hyperglycemia, hyper, the meaning higher than, or you can also have hypoglycemia, and that's where the blood sugar gets too low. And so we need to educate our community members about, there are risk factors to having hyperglycemia, to having blood sugars that are too high, but there are also risk factors to having hypoglycemia. That's where you have blood sugars that are too low. So hypoglycemia is a blood sugar that's usually less than 70 milligrams per deciliter. Now, if you if you have a blood sugar that's less than 70 milligrams per deciliter, that's considered hypoglycemia. There are some people that can function with a lower blood sugar. They're usually like athletes or people in certain situations. But for most individuals, and for our purposes, if they have a blood sugar 70 milligrams per deciliter or lower, then that means they have hypoglycemia, which can be very dangerous to them. If you don't, so if they have diabetes and they're not matching their insulin usage or insulin intake or their diabetes medication with their food, with their eating and their activity, then that can lead to a situation where they have hypoglycemia. So the doctor has usually tried to titrate it or fix it where your insulin has been matching your diet and your amount of exercise. But if you're taking the insulin and you do something that changes your diet, including not eating, right? Because I'm skipping meals, or your exercise. Hey, I'm going to get more exercise now this week. Then those are things that can change your blood sugar and put you at risk of hypoglycemia. So it's very important that if you have diabetes and you're taking insulin, you monitor any changes in your diet or any changes in your exercise, because that can throw off your blood sugars. So we encourage you, if you have diabetes and you're taking medication, don't eat foods that are high in carbohydrates. Don't skip meals. Don't increase your physical activity without talking to your doctor, right? Because increasing your physical activity, if you have diabetes, without talking to your doctor, can put you in a situation where you can develop hypoglycemia. Alcohol can also, so if you're drinking a lot of alcohol, you have an individual with diabetes and they're drinking alcohol for the holidays or for any other reason, that can throw off their blood sugars and put them at risk of hypoglycemia. And then also when an individual is sick. So if you get sick, that can cause changes to your blood sugar, and it can put you in a situation where you have hypoglycemia. Symptoms of hypoglycemia might include shaking or jittery, sweaty. You might feel really hungry. You might have a headache, feel tired or sleepy, dizzy or lightheadedness. And I told you earlier that I had a mother that had diabetes, and she actually we think that what happened was that she was taking her insulin, but she wasn't eating properly like she should have. At any rate, her blood sugar dropped very low. We don't know for how long, but she went into a coma and then she passed away as a result of that. So we need to make sure that we're educating our community members, not just about the risk of diabetes, but if they're taking diabetes, they're treating diabetes, they need to be aware of the risk of hypoglycemia as well. What you will often also see is hyperglycemia in individuals with diabetes, or in individuals that haven't yet been diagnosed with diabetes, but they're at risk of it. They're not getting their blood sugar checked. They may come in and their blood sugar levels are too high, right? And so if you find an individual and their blood glucose levels are greater than 100 milligrams per deciliter, well, that's very high, and they're at risk of having a stroke in that situation. So we want to make sure that, hey, if their blood sugars are very high, we get them to doctors that can help treat that situation. If your body can't make enough insulin, or if your body can't use it properly, as we just discussed, you might end up with a very high blood sugar, because the insulin is not there to help the sugar move from the blood into the cells where it's needed. This can come from not eating the right food. So if I go on a Krispy Kreme donut diet, that's going to lead me to diabetes. If I'm not taking my medications properly, that can be a situation where my blood sugar could shoot way up if I have diabetes. So you need to make sure that individuals that have diabetes are making sure they're working with their doctor to be on the right medication, that they're taking it properly. Having an infection can increase your blood sugar. Also, taking certain medications can also increase your blood sugar. And as we were talking about polycystic ovary syndrome earlier, there are certain hormonal conditions that can also increase your blood sugar. So you need to talk to your doctor to make sure that you're doing those things to make sure to keep your blood sugar low and away from hyperglycemia. The early symptoms of hyperglycemia, as we discussed earlier with the symptoms of diabetes, it can include peeing more frequently, using the bathroom more frequently at night. So you might go from, hey, I was using it once a night, to now I'm using it 3 or 4 times a night. That could be an indication that you might have diabetes, or you might have hyperglycemia. So you need to take action to make sure you're correcting that. Feeling more thirstier than normal, feeling more tired than normal, blurred vision. As I mentioned, my brother, that was his first symptom that he had something wrong. He had blurred vision when he was driving at night. He wasn't really able to see properly. Or headache. Now, later on in hyperglycemia, you're not able to get that sugar from the bloodstream into the cells that's needed. Well, those cells start using ketones, and ketone is going to lead to fruity smelling breath. You might also have symptoms of nausea, vomiting, shortness of breath, dry mouth, weakness, confusion, stomach pains, and coma. These are all longer term or later term symptoms of hyperglycemia. Now, addressing hypoglycemia and hyperglycemia, individuals that take the glucose, I'm sorry, that take insulin that are treating diabetes, they may have talked to their doctor about, hey, well, what should I do if I develop hypoglycemia? And so we want to make sure that they're aware that hypoglycemia is a risk factor. They're taking the insulin, their blood sugars can drop too low, so they can do things like have glucose tablets, or a glucose gel that can help raise their blood sugar quickly. They can take a half a cup or 4 ounces of fruit juice. They can take a half a can or 4 to 6 ounces of soda. They can take a tablespoon of sugar, honey, or corn syrup. These are all things, or they can take 2 tablespoons of raisins. These are all things that if a person has hypoglycemia, their blood sugar dropped too low, that can help raise their blood sugar quickly. Individuals that are taking insulin, they want to make sure that they keep glucose tablets or other source rescue foods handy, such as in their purse, at their desk, or in their pocket. And then they also want to make sure that they're talking to their healthcare provider about what to do if their blood sugar goes too high or too low. The doctor may need to adjust their medication in those situations. So what are some of the complications of diabetes? Diabetes, and I'm going to just stop for 1 second because I think I skipped an activity. So there's another activity that's in your manual that talks about that you can make. And so this is all it was is a water bottle that I drank the water out of. Let me just change my background for 1 second so that you can see me better. Okay. So this is a water bottle, and I of course I drank all the water out of the bottle, and then I filled this water bottle back up with water and put some red dye in. And this is like your blood. So I know you can't feel it, but hopefully you can see how the water in this water bottle flows very freely, back and forward. You can see, and as I said, I made this with just a water bottle. I use the smart water bottles. They work really well for this because of the way they're shaped, but just take the water and you can see how the water flows very easily. Now, that is in contrast with this, and you can see now this is the water bottle, similar water bottle, same size, and I actually filled them up to about the same level. This one has water in it, and you can see how quickly and back and forth the water flows, whereas this has corn syrup with the red dye in it. And you can see the one with corn syrup with the red dye, how slowly it flows. Even if I move it back and forward, it's not flowing very quickly. It's very sluggish, very thick. And that's what high blood glucose is going to do. High blood glucose is going to flow very slowly. And then you can also see, I know you probably can't see it well, but with this one, hey, it moves back and forth, and then it doesn't stick to the walls. But see how this one, it stays red, the container. For one, the object in here is flowing very slowly. And you can also see that it's sticking to the walls of the container, right? It's staying red. It's not like here, it clears up really quickly. But with this one, it flows down, and then some of it is sticking to the container. The container is staying red, right? So I want you to make these examples for your community. All you have to do is take 2 water bottles. In one water bottle, after you drink the water out, hopefully, one water bottle, just put some red dye in it with some water. And this will be an example of your blood that doesn't have a high level of blood glucose, right? It doesn't have high level of sugar in this blood. And you can see how easy it moves, how easy it flows back and forward, and it doesn't stick to the wall. Where this one is representation of individuals with diabetes, and it has blood sugar. So it's corn syrup, clear corn syrup. You want to use the clear Karo corn syrup, and then red food dye. But you can use this as an example, and you can see where it sticks to the walls. It's very thick. You can easily also feel how this one with the corn syrup is heavier and thicker. So now think about your heart. Your heart has to pump all that blood to around the entire parts of your body, so all your body, the cells in your body can get oxygen and get the blood sugar. It's much easier to pump this one with the water in it than it is this one with the corn syrup in it. So that's a demonstration of how it's putting more pressure on your heart to pump this around than it is to pump this around. So that's a demonstration that I would want you to do with your community members. And how to do that demonstration is also in the manual for you to use as well. So now we're going to move on to the complications of diabetes. So as I just demonstrated with this is going to put me now at risk because my blood sugar is higher of having a heart attack or having a stroke or having heart disease, right? So having diabetes, having this very thick blood that's sticking to the walls of my blood vessels and making it harder for my arteries to pump, this is going to predispose, this is going to make me more at a greater risk of having heart disease or having a heart attack. It's going to put me at greater risk of having stroke. The blood flow is very sluggish, and so getting to your down to your feet or your legs, you know, you can have blockages or it just doesn't flow properly, and so that blood, you know, has your blood has things that help you fight infections in it. Well, if your blood is flowing slowly now, and then it's real thick and it's not able to get those infection fighting cells down to where they need to be in your feet, then that can lead to where you have sores on your feet that can ultimately lead to a situation where you might have to have amputation of your legs or your feet. So you might see in many cases where individuals have diabetes. One is that, hey, the nerves also don't work as well. They can get a sore develop on their feet and not be aware of it. That sore can become infected. It takes longer for it to heal, and that can lead to amputations in diabetes. So individuals with diabetes are at higher risk of feet or leg amputations. Kidney disease. So unfortunately, a major risk factor for from diabetes is kidney disease. And there are a lot of African Americans, unfortunately, that progress with their diabetes to renal failure and they end up on dialysis. And so we do have African Americans have higher rates of renal failure and ending up on dialysis. So we have to keep that in mind. Eye disease that I talked about earlier, my brother, the first sign he had was that blurred vision. Well, that can lead to eye disease. So individuals with diabetes, to get their eyes checked often, it can lead to dental problems. Not that you're eating sweets. Yeah, sure, that can lead to dental problems. But also, as I was saying, that blood flow, the blood is carrying around cells that help your body fight infection. Well, if you're not able to get that blood flowing properly and it's not getting to the teeth, that can lead to dental problems. And then also problems with digestion, bladder control, and sexual function. So controlling your diabetes is very important. Over time, high blood sugar levels can damage the blood vessels and nerves, including the nerves that control your heart. So you're not only are individuals that have diabetes that, hey, they're going to have nerve pain in their feet, it can also damage the nerves that are around and that control their heart. So that's going to put them at greater risk of heart disease. The longer you have diabetes and the less well controlled your sugar levels, the greater your chances you'll have of developing complications. If you or someone close to you has diabetes, be sure to talk to your healthcare provider about how to prevent these complications. Now, everything I'm saying is in your manual. So I want you to make sure that you're reading your manual to your community members in its entirety. There might be parts that I skipped over in the interest of time, but I want you to go over the manual with your community members in its entirety. Now, here I'm going to talk about the ABCs of diabetes, right? If you have diabetes, follow these ABCs to lower your risk of having a heart attack or a stroke. Always talk with your healthcare provider to find out what number is best for you to aim for, since it can be different in every person. So what are the ABCs of diabetes? Well, the A in the ABC stands for the A1C. The A1C is a blood test that measures your blood sugar not over a week, a day or a week, but it measures your blood sugar over 3 months, right? So you could like you have some situations where, hey, a person with diabetes, they want to please their doctor, so they have been eating poorly, drinking tea, doing all these other things to not control their diabetes. And then, hey, my doctor's appointment is coming up next week. So I'm going to now stick to everything I need to do to control my blood sugar so that when I go to my doctor, it looks like I've been controlling my blood sugar the whole time. Well, your doctor can do a test called the A1C. And that A1C is going to measure your blood sugar over 3 months. And so your doctor will be able to tell, hey, have you been controlling your blood sugar? It might be in control when you woke up this morning and went to the doctor's office, but it hadn't been controlled over those 3 months, and that doctor can tell that by using the A1C test. The B in our ABCs for diabetes is blood pressure. And if you have diabetes, so if you have this thick flowing blood here, your blood pressure is just going to add on to that, right? So imagine your heart, it has to pump that blood pressure. As I said, pressure is the force on the walls. Well, it has that resistance, that force on the walls, which is elevated, but now it's also have to pump this very thick liquid around it, just thick blood. So blood pressure control becomes very important. If you have diabetes and you have high blood pressure, it's very important that you control both. You control your diabetes, but you also control your blood pressure, because both of them are now going to put extra strain on your heart and make it more likely be a risk factor for cardiovascular disease. The C is also the same thing with cholesterol. As we discussed earlier, if you have high LDL cholesterol, that's, the LDL cholesterol is lousy. We want to keep it low. But if you have that high LDL, that high lousy cholesterol, well, that's going to increase your chances of developing plaque formation in your arteries, right? And that plaque formation, along with this thick liquid, along with the blood pressure, well, all of that is leading to extra stress on your heart. And so if you have high blood pressure, if you have diabetes, and you have high cholesterol, that all of that is going to increase your risk factor for heart disease. And we need to figure out how to control all aspects of it: your blood pressure, your blood sugar, and your cholesterol. And then the S is for stopping smoking. There's no good reason ever, period, nonstop, to start smoking. There is no reason, there's no good part of smoking. So if you're smoking cigarettes, then we want you to try to stop. So that's the ABCs of control for your diabetes. Now, I'm going to now move to food label activities. As I mentioned earlier, I would love for you to be able to do the sugar demonstration. Yes, on page 7.3. If you can, then buy the sugar cubes. The sugar cubes work best. 1 sugar cube, I would think, is 1 teaspoon. And then do the food label activities here. That will really demonstrate to your community members about the amount of sugar they're getting in their in the drinks that they have. But now we're going to move on, and we're going to do a food label activity. So we've done food label activities already with when we were talking about high blood pressure and the salt content in it. Remember, we talked about sodium. The sodium is the amount of sugar. I'm sorry, the amount of salt that is in your food. We did a food label activity with that. We did a food label activity when we talked about fat and saturated fat, and then looking for foods that are lower in saturated fats, higher in unsaturated fats. And then now we're going to do, we also did a food label activity when we were talking about portion sizes and how much food we're taking in, what those portion sizes are, and trying to decrease our serving sizes and looking at how many calories we're taking in. But now we're going to do a food label activity related to the amount of carbohydrates. So when it says carbohydrates, that's another name for sugars. You'll see sugar. So under carbohydrates, total carbohydrates, you will usually see dietary fiber. That's a type of carbohydrate. And then you'll see total sugars. Your total sugars, as we learned before, your body is going to turn all of the sugars into glucose. It's not going to turn dietary fiber into glucose. Dietary fiber mean, hey, it's a substance that's just won't break down. So like the skin of an apple is high in fiber. And they tell you to have high in fiber foods because your body has a harder time breaking that down. It's going to stay in your digestive tract and go right on through. And then foods that are high in fiber help to clean out your digestive system. They're going to make you poop more, right? High fiber foods. If you eat a lot of raisins, if you eat a lot of prunes, those other high fiber foods, the dietary fiber really doesn't break down that well. It doesn't digest that well, and it'll go straight through, and then that helps to clean out your system. But we're talking here about carbohydrates. We're talking about the sugar, and the sugar is going to be broken down into glucose, and then put into the bloodstream as your blood. That's what's contributing to your blood glucose. So looking at our food labels again, food labels help you to choose foods that are lower in calories and lower in carbohydrates and sweeteners. Here's a food label for a 12-ounce can of regular soda. So a Coca-Cola, if you have that for your community members, that would work well. And so we'll see here that one serving size is 1 can. This 1 can is a 12-ounce can of soda. That's one serving size. So if you have a 16-ounce, right, that's no longer a serving size based off of this nutritional label. A 16-ounce now is going to be one, and you're going to have one serving size, plus you're going to have a quarter of a serving size, right? That's 1 1/4. But you would need to look at your food labels, and this 12-ounce can is one serving size, right? In this 12-ounce can is 160 calories. 160 calories in this 12-ounce can. Now, where is the calories coming from? It's not coming from fat. There is 1 gram of fat, but there's no saturated fat, no trans fat. But the calories are not coming mainly from the fat. The calories are coming all from the sugar. And in this can of Coke is 37 grams of sugar. So that's quite a bit of sugar, right? That 37 grams of sugar, or the added sugar, is 14% of our percent daily value. So remember, we talked about, hey, you got 100 budget. You've just used 14% on this 1 can of Coke, right? So you want to look at, as I said, number 1 is serving sizes. Number 2, amount per serving. So I said this 1 can is 12 ounces. If this was a 16-ounce, that's different. If it's a 24-ounce, right? Now you have to multiply everything by 2. And unfortunately, we have individuals drinking 24-ounce sodas. That's a regular occurrence now that people buy 24-ounce sodas. And so they're drinking 2 serving sizes. And so then they would have to multiply this 39 by 2. Now they're getting close to 70, close to 80 grams of sugar in that one bottle of 24-ounce Coke. They're getting close to 80 grams of sugar. That's a lot of sugar for us to have in our diet, in addition to whatever we're going to eat with it, right? So usually individuals don't just have a Coke. They might have a Coke and a honey bun and some potato chips or something else, right? So now look at all of the sugar we're taking in that one meal, right? Too much. And this is going to lead to obesity. We also have our percent daily value that we want to look at. Remember that percent daily value, products that have a 5% daily value, that's low. That's where we want to keep it. If it's greater than 20% daily value, this can of Coke isn't. If you have 2 of them, it is. But you want to make sure that you're keeping it less than 20% daily value. And then your calories and your carbohydrates, you want to look at that with your food label. Okay, so now we want to do a food label activity. We want to compare. And so here, we're looking now at the total carbohydrates. We have our fruit, 100% grape juice. And hey, you might, our grape juice, wouldn't that be healthier than our unsweetened tea? Well, we're looking at carbohydrates. this 100% grape juice has 37 grams of 35 grams of sugar, whereas this unsweetened tea has 0. So our choice here, if we're basing it off of carbohydrates, is that we would want to choose the unsweetened iced tea. You have our cooked oatmeal versus our toaster pastry. Our cooked oatmeal has 13 grams of sugar in it. You know, that would be very a decent amount of sugar is less than 5%. Whereas our toaster pastry has 39 grams or 17 grams of added sugar, but it has 39 grams of carbohydrates and 17 grams of added sugar. So we can see here that it's higher in the sugar category. So we would want to use our cooked oatmeal instead. So there are other food label activities in the manual. I just want to really quickly look through the manual because in the back, as I had mentioned earlier, you want to make sure that you're doing the handouts with your community members. And so with the diabetes section, I'm just going to share my screen again. Starting on page 7.30, you'll have your handouts, and you want to be able to go through what the definition of diabetes is. They can take this handout with them. Diabetes is where the insulin is not helping the glucose get into the cells. There's type 2 diabetes, and that's what we mainly discussed today. You have the symptoms of diabetes. You can see here, using the bathroom more frequently, and then increasing it at night, feeling thirsty, all of these. Some of these symptoms may be not just for diabetes, but for other things. So you want to talk to your doctor and make sure you're getting checked. Making sure that you're caring, particularly for your feet. If you have individuals with diabetes, it's very important that they take care of their feet, because if they don't, they can lead to amputation. And when you have an amputation occur, it can then set you up for all of the other risk factors. You're no longer getting the physical activity like you should. You're no longer doing certain things. So it can really put you at risk. And then making sure that we talk to our community members about the ABCs of diabetes. A standing for stands for A1C test. B stands for blood pressure. C stands for cholesterol. And S stands for stopping smoking. It's very important that we stop smoking. Do our food label activities, and it's very important that you go through these food label activities with your members of your community. And then, as I mentioned earlier, I do encourage you. So 7.3 was where you can find the different things. As I mentioned earlier, one, if you're using sugar cubes, 1 sugar cube usually equals 1 teaspoon. And then go through these activities of helping them guess the sugar, and they can see how much sugar is in all of these different drinks. And then here just gives you a little bit more about how much we see. So of course, water is going to be 0. Unsweetened tea is going to be 0. Your Diet Coke is going to be 0. But then you get into where a light lemonade might have 7 grams, or 1 and a 7/8, close to 2 teaspoons. Your sports drink, so the Gatorade. You know, I do drink quite a bit of Gatorade. It could have 5 teaspoons of sugar in it. Your tea, so reading our food labels can help us to understand how much sugar we're getting in the foods, and then you can see how many calories. So that grape juice, that grape juice is going to have a lot of sugar in it. So even if it's 100% grape juice, and you may say to me, well, hey, but I thought grape juice would be good. Well, what's better is eating the grapes, right? Eating the grapes will give you access to the fiber that's in the food, as well as give you access to the grape juice that might be the juice of the grape that might be good for you. But that's better than drinking grape juice. Is better than drinking alcohol as well. But we want to make sure that we're reading our food labels, and that we're considering how much sugar is in each of our food, and then also how many calories are in our food. And we can see with alcohol. So alcohol is going to be very high in not sugar content, but how many calories it has in it. And so you just want to make sure that you're going through these handouts with your community members. And then here is a soul food makeover, really talking about creating something that in terms of sliced fruit that your community members can eat. That's better having sliced fruit than drinking that grape juice. So that ends our session on diabetes today. I do look, I am happy that I have been able to talk to you about the risk factors of cardiovascular disease, including diabetes. If you have any questions at all, please feel free to reach out to the Mayo Clinic staff. And thank you so much for being a part of this program. Thank you.